All right, everyone. So welcome back to our continued episode here with Keith from Physician Standard. So last time we were with him, we talked about, some of the amazing products that he has and how it's really helping with gastrointestinal health, liver health, as well as neurological health. But one of the things we scratched the surface on was the liver gallbladder flush. And I have personally done this and taken a few patients through it. And it has been such an amazing response that we've seen. So I want him to talk a little bit more about it because I think that there's a lot of different types of liver gallbladder flushes out there. And there's a lot of mixed information about how to do it properly and what materials to use. But I do find that the products involved in the physician standard liver gallbladder flush really is effective, and it's effective in a shorter amount of time than other flushes. So I'm going to let you take it away and talk a little bit more about it.
Okay. So I've been doing this for about 18 years, doing flushes. And I did the Hilda Clark's one. I did that for like 10 years. Mm-hmm. And it worked. I always thought it could be done better.
Yeah.
Right? And, you do these Epsom salts and it tastes awful. And, you do it twice and then you do it twice the next day. And anyway, it works. But I didn't get really what I wanted out of it. Mm-hmm. So I played around for years, actually. And what I've discovered is I use my O2 cleanse, which is the magnesium oxide, magnesium hydroxide. Mm-hmm. And when you chase it with a citric acid, like for instance, lemon juice, mm-hmm. The citric acid combined with the hydrochloric acid in the stomach breaks the magnesium from the oxygen and saturates your bowels with oxygen, which is like a sandblaster.
Yeah.
Just everything comes out. Right? And so what I discovered, I was doing it like, do that, do this. And I said, maybe it's just better the night before, the day before, preferably maybe 5 o'clock. Mm-hmm. You finish your meal 2 hours earlier than that, or you actually can finish at 4 and do it at 6. And you may have diarrhea up until the time you go to bed, but pretty much you don't go all night with diarrhea. Mm-hmm. And so now the bowels are clean. Right? You flushed a lot of stuff out. So in the morning, you just take the gallbladder mixture, which not only makes the liver makes more bile, so you have more pressure, but it dilates the bile duct and it makes it able to expand triple, quadruple what it normally would do. Mm-hmm. So when you take the mix and you take potassium first, mm-hmm. because when you have a lot of diarrhea, and especially dumping from the liver protects itself with potassium. Mm-hmm. So when you dump it, you're going to dump a lot of your potassium. So I use new salt and a third of a teaspoon before, like a half hour before, and then I take my gallbladder mixture, and then an hour later, I take almond oil grapefruit. Now, a lot of people use olive oil. Almond oil is so much better. It tastes delicious. You blend it a little blender, 4 ounces and 4 ounces. You drink it down. And then an hour later, you take it again. Because normally in Hilda's, you only do one oil. Because she doesn't dilate it and she doesn't promote more bile. And with mine, it produces a ton of it. And in fact, almost too much. So you have to be wary how often you take the oil. For instance, if you take the gallbladder mixture and it's normally an hour before you take the next oil, if you feel just remotely queasy, anything disruptive in the digestive tract at all, mm-hmm. you take the oil early.
Okay.
Otherwise, you got a bunch of bile and upsetting the stomach, and there's nothing to digest. Mm. Okay? So then once you do that, you wait for another hour for the second one. Now, if you feel queasy in between that time, even if it's a half hour, that means your liver's so impacted and it's coming out so rapidly that you need to take the oil early.
Got it.
And then normally we wait 2.5 hours and you take the O2 cleanse to push it all down the digestive tract. But here's the key. You wait 2.5 hours. But anytime in between that 2.5 hours, if you feel queasy again or just something odd about the digestive tract, you think, hey, something's happening,
Mm-hmm.
then I recommend you take 2 and 2, 2 ounces of almond oil, 2 ounces of grapefruit, and drink that again. And normally that does it. Now, on a rare occasion, I even had people had to do 4 doses
Mm-hmm.
because they got to close to 2.5 hours and they started feeling queasy. Here's the key to this. If you feel queasy, you got to take the oil. And even if it's 2 minutes before you're going to do the O2 cleanse to push it down and you're just done with the whole process,
Mm-hmm.
if you don't, you've got bile and you mix it with O2 cleanse,
Mm-hmm.
you're going to get nauseous and throw up.
Okay, that's really interesting because I actually did have that happen to a patient, is that she was barely able to get through because of the nausea, and she ended up, things started coming up. So so that's an interesting thing to know, is that it's just a lot of bile that's sitting there causing that irritation.
It's so much coming out.
Yeah. I actually have a question then in relation to after, post cleanse. So we have had maybe 1 or 2 people that felt kind of nauseous for 2, 3 days post doing the cleanse. And they said it was very successful. They saw tons of stones. And my assumption was really that they just have more to go, and that they potentially needed to do another liver gallbladder flush. And one person, she did that and she felt fine. And then there was one that she found that she was actually feeling continuously nauseous, but also found that she started to have her anxiety rise. So if you could speak to that, I think that would be really helpful for practitioners to kind of know how to troubleshoot these things.
Okay, so here's really interesting.
Mm-hmm.
Think about it. When you have a thought, you produce a chemical, and that chemical goes through the lymph system down to the liver, and it bonds and makes bile acid as an aspect of bile acid.
Mm-hmm.
So let's just say you've had your liver backed up for 20 years.
Yeah.
And all those chemicals have backed up into the liver because it couldn't go down the digestive tract. And so you've been hormone deficient, more moody, more this, more that, fighting. So if you have a fight or a tragedy or anything, all those chemicals haven't gotten out of the system.
Mm-hmm.
It's been back up into the liver.
Yeah.
They call it the angry organ because,
Yes.
because all these chemicals are still reactive.
Mm-hmm.
So I've had people go back in time. They release the bile, and now they're having traumas that have happened in their life. Normally it's the first ones that come out are the most recent.
Yeah.
So then they think, oh God, that's fine. And they have these visions or these thought patterns that pop out of nowhere.
Mm-hmm.
So it can give you anxiety or depression almost.
Mm-hmm.
And then the more they do, the deeper it goes into the liver, the more chemicals that are built up with more trauma. I had a woman that couldn't make a fist without bleeding because she had psoriasis,
Mm-hmm.
eczema kind of thing. And she was like 38 years old, really a lovely person. Her dad worked for Kaiser
Mm-hmm.
as a dermatologist, head of the department.
Mm-hmm.
She'd had it for 5 years. He couldn't fix it,
Mm-hmm.
right? So we did a liver, and within that 11 days, it was like 80% better.
Mm-hmm.
Okay. And, but she ended up having to, every time she would do it, she would have a thought pattern going back in time.
Mm-hmm.
And she had a lot of trauma. I don't know where it all came from. All I can tell you, it was pretty, I think she did 17 of them before she had no thought pattern.
Wow. That's
so it's kind of amazing. I would think, 2 or 3 would have cleaned it up and everything, but there's residue that's lingering in there.
Yeah.
And my wife, at the time she wasn't, she had thought patterns. And by that way, this also happens with people that do coffee enemas.
Yeah.
Okay, they get this trauma that comes out because everything's coming, the waste materials being regenerated,
Yeah.
and it's dilating the bile duct and allowing these chemicals to come out. So a lot of, trapped energy like that disrupts the whole body.
Yeah.
So they've been disrupted for 20, 30, 40 years, depending on their age. So anyway, so I thought I'd comment on that.
So, kind of going into your adrenal product then, because when we were talking, you were mentioning how the adrenal product is something that also, in kind of the right context, can be used to help with certain types of either PTSD or emotional patterns that were triggered by adrenaline, really scary moments and things like that. So I'm just wondering, like, in these patients that are doing the liver gallbladder flush and having all of this release, and they're clearly noticing a little bit of a roller coaster emotionally, would you be bringing in different products, the adrenal product being one?
Okay, so this is interesting. The adrenal cortex, we actually take the gland and suck up the fluid, not a glandular where we're taking the meat of it. We're taking the fluid of adrenal cortex, which is normally bound to adrenaline. So I was watching 60 Minutes, and it's funny where you get all these ideas from. 60 Minutes was talking about a woman that got raped, went into an insane asylum for 20 years, and all of a sudden got better. And they try to figure it out. So they figured out that she changed her hypertension drug. And then they figured out the hypertension drug got rid of adrenaline, the production of adrenaline. So she was in this fight or flight mode where she would think about the trauma, store the memory, think about the trauma, store the memory, think about the trauma, store the memory. She couldn't get out of the loop. When the adrenaline wasn't being produced because of this hypertension drug, it would go up but not store, not store, not store, to where it was not there anymore, and she got better. So my suggestion is, and what I saw a sequence after that, they always have a follow-up, and they said that they came up with a therapeutic process where they would write out their trauma. They would take first the drug, and then they write out the trauma, and then they would do a week later do the same thing, but they would just reread what they wrote, and they would add to it, right? Well, I tried it on my wife, first one, and she came up with a lot
You're going to be my guinea pig.
Yeah, this week. She's a guinea pig all the time, actually. But they're all good. And it worked like a champ. We took the adrenal cortex, and she wrote out thing, and she cried, and she had all this emotional thing. And a week later, we did it again and added to it. And sure enough, the trauma goes away. This is built up energy in your brain, your body, that needs to be released.
Yes.
Right? And it's quite amazing what it does. And this adrenal cortex we have is actual adrenal cortex separated from the adrenaline. So it has an affinity for the adrenaline, and it calms you down so you can handle the trauma. So it's pretty amazing product. It's we have a 5X and a 300X. And it's 60 times stronger. It's more for the more severe cases.
Which one?
The 300X.
Got it. Yeah, I think that it's just really fascinating for people that are listening, of understanding that when we have gone through emotional trauma, that it's not just about, the stress that it creates or the memory that it creates, but it's actually really impacting our bodies chemically. And I found that, the people that we work with that have gone through trauma, and maybe their primary route of therapy was talk therapy, that, some people do really well, and then there's other people that don't. And it's really just because chemically they're still imbalanced. And we're not talking chemically that they just have a deficiency of serotonin, which is the assumption. It's always just a serotonin problem. When in reality, we have adrenaline, we have GABA, we have dopamine. There's so many other neurotransmitters that are being completely ignored through medicine. And, it really is just asking better questions to understand the root, and then also to be able to understand, is there a chemical tie to this? And if you can bridge the two worlds, that's when we actually see success.
You're absolutely correct on everything you said. And we have to expand. We have to have guinea pigs.
My husband's my guinea pig, so I totally get it.
you know, but it's all, when you're using natural products, you don't have the side effects. And when you're taking things like adrenal cortex and things that are detoxing you, you do go through a crisis of elimination. But it's minor compared to what you get out of the back end.
Yeah, for sure.
So
with the liver gallbladder flush, going back to that. So again, for you guys listening, to take away is that the liver is an organ that does hold a lot of emotions and emotional trauma, especially when it comes to anger, resentment, rage even. So just by simply helping to detox this organ, this could potentially be bringing up things that the person has gone through that maybe they are still holding on to, if they're conscious of it or not. But in the case that someone goes through the liver gallbladder flush and they feel better, but maybe are still like, my stomach is just a little off, what would be something really beneficial to bring in as like a post protocol? I would think that the alpha sufflex could be a really good thing to introduce after the liver gallbladder flush, but I would love to have feedback about, what are some of those key products that are going to now help to create an overall healing for the gut.
Okay, so, we need to have the para A, para B to kill off a lot of the inflammation that, and the reason that the thing's backed up is because there is inflammation in the bile duct that's backing up this bile. So I think it's parasitic, bacteria, fungus, all sorts of things that cause this. So you need to make sure that you're taking this for a number of days so that you just don't assimilate those bad chemicals back into your body, or those bad pathogens. But we have a digestible product. I don't know if you've tried it, but
I haven't.
That product is absolutely amazing. You have an upset stomach, 10, 12 minutes later, it's gone. It actually works on rebuilding the lining of the digestive tract. See, everybody's working about probiotics and things of that nature, but the lining is so damaged, right, that you need to actually support it to rebuild. Yeah. I'm going to make a product that's going to combine probiotics with this. I'll get around to it. But right now, it rebuilds the lining, and I'll give you an example. Another guinea pig, my daughter. She had acid reflux, and she got it mainly from one time she overdosed in drinking, and she had it from then on. And I talked her into taking this, and she took it 4-day. Because she can afford it, because I gave it to her. It could work with 2 a day, but 4 she did for the first month, and then 2 thereafter for another 2 months, and no more acid reflux. She was getting so bad that she would get herpes weekly, right? And no more herpes, so she not only fixed her digestive tract and all the nauseousness she was, occurring, she can actually have drinks now and not get the acid reflux, which was just killing her. Yeah.
So what are some of the ingredients in that product?
That particular product works, and you're going to look at the ingredients and say, oh yeah, that's okay. I don't understand this, ingredient. We work more on the atomic weight. We actually take a base material that has this particular atomic weight, look at it as a certain key that we need to open up and let the digestive tract work properly, right? Key, allowing the nutrients and everything to come in there. So we're looking for this key versus the ingredient, right? And so sometimes we take, chamomile, right? And we may take a kilo of it and only get 5 grams of the key. We have to extract it because we put it in this thing in chamber where it goes to atomic weight. And when you get the key, it's like a miracle. It's just amazing what it does. It's almost instantaneous. The same thing with our Neuro Ease. That's under atomic weight. That's for like tight shoulders, lower back, fibromyalgia, which symptoms, right? Similar like fibromyalgia. And it works incredible. Have you ever tried that one?
I have not personally had the Neuro Ease. I know that because we do the autonomic response testing by Dr. Klinghardt, we do find that a lot of patients test for that specific product.
It basically, in our studies of it, it knocks out excess cortisol.
Okay.
And cortisol, okay, so here's my example of what fibromyalgia is, right? You bump a person's shoulder. They're toxic. And so the communication with the brain versus the shoulder is skewed. And so the brain says, hey, I see something happen here, but I can't get a good picture on how severe it is. So it produces a bunch of cortisol to come down here. Not needed. It's just a bump. This cortisol, even though the brain loves the brain loves cortisol, the body loves cortisol, in excess, it comes back up to the brain. In excess, it's the number one cause of brain damage. Think about that. So it starts to damage the brain cell, making it fire its neurons, making the muscles contract around the body, especially around injuries, causing a lack of blood flow and oxygen, causing pain. So a good example would be, here's an extreme example, somebody that says they have arthritis in the hip and they're walking really slow, right? And they, oh, yeah, I got this arthritis. It may be just a smidgen of arthritis that's being overreacted in a moving object. So it clamps down, overreacts, clamps down, overreacts, clamps down, overreacts, and then they can't barely walk. I've had hundreds of people say it's a miracle. You just take it, next thing you know, you're walking normal.
It's just so interesting too, because all of this is such a trickle-down effect, because the more cortisol, then the less melatonin you have, and now you're not sleeping properly and you're not healing properly. So I think
it is a balancing act.
Exactly. And I think that that's one of the biggest things that I'm trying to teach through this institute, is helping people to understand that there is such an integration of systems, and there is such a trickle-down effect when it comes to these different hormones and how the brain is communicating with the body. And we have to take a step back and really do better testing so we can figure out, what's the biggest problem here? What's the foundation here? Because if we're going to try to go and manipulate these pathways and say, oh, I'm going to target, this hormonal pathway and this hormonal pathway, it becomes such a juggling act, because there's so many enzymes and cofactors and everything else. So we need to look at the toxicity. We need to look at, do the detox pathways work? Does the liver work? Is it clogged? Getting back to the foundation, which a lot of times you strip away the bad stuff, and we're going to see a lot of these pathways correct.
I totally agree. And this is why the gallbladder is the hub of the body. Is everybody thinks, heart, this, that, and the other. But really to function properly, without the bile duct opening up and releasing bile at the time you have fat, and the bile emulsifies the fat so the enzymes can break it up into cholesterol again, which is crucial to the body, which makes vitamin D, basically the skin has cholesterol in it, the sun hits it, makes a chemical, goes to the kidneys, makes vitamin D. Without the cholesterol being emulsified, and I mean the oil or the fat being emulsified to make cholesterol, we don't get enough vitamin D from the sun. Then the cholesterol makes what they call pregnenolone, the master hormone to all hormones, and then that feeds the adrenal to make estrogen, progesterone, testosterone. So if you try to go around the system and give the system specific things like, testosterone or estrogen or these things, you're disrupting the basic biofeedback loop of the body.
Yep.
So I make a DHA pregnenolone.
Mm-hmm.
And the reason I like that, and I don't make the other hormones or do it, which I could, right, is because it's the 1 and 2 hormone in the bloodstream. And it is secreted, and the cells determine if it wants it or not. The organs determine if it wants it or not.
Mm-hmm.
It's constantly in the bloodstream, so it's grabbing it or not grabbing it based on need,
Mm-hmm.
right? If you take this and it goes almost directly into the bloodstream because it's sublingual, it bypasses the liver. See, if it gets to the liver, you take a pill of DHA pregnenolone, it's going to go into the digestive tract. It's only about 18% absorbable, so you've got a waste material that has to be processed through the liver. The 18% then goes into the adrenals, and now the adrenals have to do something with it. It's almost like shoving it down their throat, saying, hey, I got all these things, I must need it for something. And it starts to make hormones that you don't need. Maybe too much estrogen, maybe your pathway, maybe your genetics force it to go one way that you don't want it to go.
Mm-hmm.
But if you take it orally and it goes into your bloodstream, it suffices the number 1 and 2 hormone, which takes a huge burden off the adrenals, because they now at this point they don't need it for that short period of time,
Mm-hmm.
few hours. Now it can produce the other hormones
Mm-hmm.
that you do need in greater amounts because the factory has more free capacity.
Mm-hmm.
Does that make sense?
Yeah, for sure. For sure.
So you try to bypass as much as possible and let the body figure it out itself.
Yeah, I definitely couldn't agree more with that. And in the beginning of my practice, before I knew better, I was trying to create the balancing act of, hormones or the endocrine system, and we would just not really see it go anywhere. And if anything, we would create more problems because we think that we're going to be able to manipulate these pathways and correct them, which it's impossible to do if you're doing it with the wrong approach, essentially. So it was definitely something I got away from and started to really focus on, the key players, which the adrenals, the liver, all play, the biggest role in all of that being balanced. So
And it's the hub. And if you don't fix the hub, you can't fix the rest of the body.
exactly. And the liver is just such an important organ that even if you're a beginner and you're like, I'm so new to this field, is if you can help people to restore the integrity of their liver and gallbladder, you're going to see a lot of their problems dissipate. And it's because it's just, the liver is so overloaded. And I always laugh when patients are like, is this because I drink wine? And I'm like, that's like this big of the puzzle right now, but your liver is dealing with pesticides and herbicides and heavy metals and mold and all the toxins from your personal products and everything else. So it's just getting tired, but it's getting tired younger and younger now because we're being exposed to so much.
The 20-year-olds, the 16-year-olds are sicker than dogs.
Yeah.
I mean, their whole system is corrupt from the beginning to the get-go. I mean, look at autism going up to 150, what is it, per 1,000? What is it?
I think like 1 in 3 or 1 in 4 kids. It's
huge.
Yeah.
So, and I have my own theories on how to prevent that. And especially if you have women that are going to get pregnant or want to get pregnant, they have to clean their act up.
Yeah.
They have to get that chamber ready for birth.
Yeah.
They have to have an environment that the baby is comfortable and loving and caring. You can give it that from the outside, and that energy, I believe, goes through that, right? Through the membranes and protrudes into the baby. But if you have a dirty environment, if you have the slums of LA or something, you're not going to have an environment. It's going to come out not fully developed. That's why they have a lot of digestive disorders in the babies. They're having a lot of malfunctions in everything.
Yeah.
And the sperm count in men is like almost 50% down.
Mm-hmm.
So it's not only the woman that has to clean up, the man has to clean up before he plants his seed, because his seed is made then.
Mm-hmm.
A man produces 5,000 sperm like a minute
Mm-hmm.
every day of his life,
Yeah.
right? And so his is new. So if he's eating bad and corrupt, he's going to corrupt that sperm.
Yeah.
And a woman has the egg, but she has to clean up the environment because the egg is protected to a certain extent.
Yeah. I do
So
feel that one of the biggest reasons for infertility right now is because it is not an opportune environment for, the development of a baby. And when we do the testing and we see all the infections and we see the pathogens, the toxins, et cetera, and I'm like, well, this is the reason why your body it knows better. It's saying, no, we're not we're not creating anything in this type of environment. So it's very interesting because I've had women, they've been through the ringer of so many different avenues of fertility treatment. And then when, I had a woman recently, she came in for her sinuses. And then when I was doing her testing, we found that her sinuses were being affected by spirochetes that actually started in a dental cavitation. And then when we did her blood work, she had active Lyme disease. And I'm like, I don't know how long this has been going on, but clearly this is here, it's affecting you. And you have just, been trying to get pregnant and you feel emotionally beat down, thinking there's something wrong with you, when in reality, you have this infection that your body's like, no, we're not putting a baby in this right now.
no, the body's intuitive. It knows when it's ready to go and when it's not.
Yeah.
And the thing is, but it has such a desire to have that occur
Mm-hmm.
that it sometimes makes bad choices.
Yeah.
Okay. So, we have to educate. We should have a whole thing about just preparing a woman and a man both
Yeah.
for having children.
Mm-hmm.
Because look at the thing, you prepare, it's like a stitch in time saves 9,
Mm-hmm.
right? If you don't take that first stitch and fix it correctly,
Mm-hmm.
then you're going to have autism maybe, or a sick thing, or a child that's mischievous and doing beyond normal, right? I mean, first thing, we don't want to ever cut these things about suppressing children's creativity. Oh, you're doing that. No, stop doing that. Is ridiculous. A child should be a child. There should be boundaries. They need to have boundaries because they want boundaries. But we need to talk about this in a whole seminar.
Yeah, I agree. I think some of the things that have stood out to me that I want to do on future modules, one is actually talking about kind of expanding upon the conversation we had before we started with the neurological symptoms in one of your employees, but also talking about how to leverage some of those products that you have, because these products can be used in the sinuses, they can be used in dental issues, they can be used in, poor functioning tonsils in order to take stress off of the neurological system. And I think that is going to be really helpful for, as my other modules, I start to talk more about neurological degeneration and neurological conditions.
I agree. And, talking about tonsils, they take out the tonsils too readily.
Okay.
I know that they're having problems, there are problems, and then they take them out.
Mm-hmm.
If they went to the root cause of it, I can almost guarantee you that you never need to take your tonsils out.
Yeah.
Right? So, and the tonsils are your first line of defense of telling you that there's an infection.
Yeah.
So, we've got to look at health differently.
Mm-hmm.
We have to educate, and I appreciate everything you're doing here.
Mm-hmm.
And this is, we got to take my videos, other people that have their concepts, and then discern which one's working in different avenues and make it happen.
Yeah, no, 100%. And the goal is obviously when it comes to supplements, I love hearing from the formulators of why you create what you create, and even talking about atomic weight. I'm like, I would have had no idea about that, taking that into consideration. So I think it's just so helpful for us as practitioners of really understanding the level of knowledge and depth that goes into the creation of these products and how they might be geared towards, say, a joint pain, but it's actually helping the neurological system and controlling cortisol. So that's the stuff that I love. And I think it's so important for other practitioners to understand the nitty gritty of what they're recommending, because we hear it all the time as practitioners is, hey, I know you gave me that supplement for this, but I noticed this and this went away. And then you could actually speak to it and be like, oh, wow, okay, so that's because of this. So I'm very excited about doing this, and I appreciate all of your time. And I definitely am excited about talking further about, preparing men and women for pregnancy, also talking about some of your amazing products to help with neurological conditions as well. So we'll definitely be putting that on the schedule to get those recorded as well.
Sounds great to me. I love doing this.
Awesome.